close this first Dental Insights live panel discussion, I have one last question for each of you, and it's the same question. In a few sentences, would you be able to tell us what you did wrong? And the reason why I asked this is that, hopefully we all learn from our mistakes, and we can teach people and hopefully give words of advice to not make the same mistakes that we did. So we want people to take that home with them. So Carolina, what did you do wrong?
Well, there's a sentence that we love in the spiritual world, and I have to close with this, is that if you change the way you look at things, the things you look at change. So it's about changing the way you look at things. I have changed. I would definitely want to help more people, but I could not lower my standards, my clinical standards. Because that's how I was raised as a professional by the first mentor I had, Marc Bola. I do have to mention him. And he made my professional standards be up there. Sometimes I hate him because of that, but I owe it to him. And then, of course, Carl Misch and Jacques Bory and you name them. So yes, I would by all means try to make treatments more affordable, meaning accessible to more people. But I also would focus a lot on lowering patients' expectations. Patients that want teeth and that want implants, they come in and they want ceramic and they want this and they want that. And an overdenture will give them such a more long-lasting result, such a more beautiful aesthetic. And we have to educate patients at that level there. Consumer expectations are what they are, but we are the professionals and we have to learn to lower consumer expectations. And that will allow us to give them long-lasting treatments, good quality treatments. And then you set aside a nonprofit in Africa to cope with the guilt side if you're in a high-end, and one mistake that I made, if there's one mistake that I made that I would try to advise not to make it, is I promoted myself because of fear of having competition. You have to promote a brand, not a person, because otherwise when the person is not there, no money comes in. And that's what happened to me. I was never able to take a 1-month vacation while I was a dentist because I had promoted myself, not the brand.
Thank you for that very honest answer. Rick, same question for you. What do you consider you did wrong?
I think the biggest mistake I made in my life, all right, was the fact that I had to have an early departure from patient care. I loved doing surgery. I was trained by Carl also. That was what, floated my boat. Every day I would go in, I loved the thrill of it. The problem is that I had to leave dental care early because of an ergonomic injury. All right, it was totally unnecessary what happened to me. So I really should have taken better care of my body. Body, mind, but your body, you got to follow ergonomic principles when you're working because we're at the chair. It's a very, very demanding, super demanding profession. And I really do believe that should be a focus. If we're too wrapped up on day-to-day treatment and not paying attention to what's important for ourselves, for our own health, we'll eventually break. So take care of yourself, enjoy the journey, and don't try to rush it.
Thank you. All very, very honest answers. I love them. And I feel like those two answers are to take through life with whatever you do. So I personally appreciate that since I am not in dentistry.